Okay, welcome to the Board of Health meeting for the City of Gardner. It is October 27th, 2025, and it is 4:37 p.m. First thing on the agenda is public comment on agenda items, and we ask that you limit the time to 2-minute time limit per individual. And it has any item that's on the agenda. So I know that we do have some people here. If anyone wants to speak, you just state your name and address and what the topic is, what you want to say, and try to limit it to 2 minutes.
Okay.
And if anyone, make sure everyone's signed in.
Mm-hmm.
Is there anyone from the public who wants to speak?
Yeah, I suppose it's me.
Okay.
My name's Betty Correa. I live at 61 Lake Street at Haywood Buildings. Our problem is bed bugs at the building. And it's been an ongoing problem for quite a few years, actually. But it just seems that when they get somebody to come in there and supposedly fix it, we've had one person or one apartment that refuses to let the people in there to spray their apartment or whatever, to the point of a gentleman came in that takes old furniture and whatever, and the mattress was so bad he wouldn't take it. And right now, as far as we know, it's still out on the porch, which isn't helping the building any. Now, this poor lady here has had to pack up her whole apartment 4 times.
This is the fourth
This will
time.
be the 4th time. And, I mean, sorry, but the poor lady's 75 years old. You know, it's a strain on her. And I mean, and they won't help any, you know, the maintenance or anybody. It's either, you know, family members who are all about the same age. And I said, it's ridiculous. And if they're gonna spray, like right now they have a spraying Wednesday. Yeah, Wednesday and Thursday. Why isn't the whole building being done? Not just like 6 apartments. And it's like, why? Well, and also on Wednesday, they're doing the laundry room, which quite a few times has had bed bugs in the laundry room. Well, we got this notice Monday or Friday, that they were gonna come in and do the laundry room and treat the laundry room. Well, in my mind, if they're gonna treat it, then there's something in there, but the laundry room's been open all weekend long. Now that makes no sense whatsoever. It should be locked, nobody should be allowed to go in there, because if there's any more in there, they're just gonna take it to their apartment and spread it more. I mean, it only makes common sense. And then I was told today that like at night, I've been making sure the door was locked. Well, then security comes around and they unlock it, and they told somebody, well, the door's not supposed to be locked.
The laundry room?
Yeah. So it's like, you know, we're damned if we do and damned if we don't. We're trying to get the situation solved so there's more of us that don't get them. And it's just, I mean, I know Jen is working on it and she's working with it, but it just makes no sense the way things are going. And I mean, there's not only her, there's another lady that's had to pack up quite a few times. And I mean, we're not just talking a few things, we're talking your whole apartment just about has to be packed up. And I mean, I know they spent over $50. They tell them, well, put your clothes in the dryer on high for like 40 minutes or something like that, then wash them and then re-dry them. That's a lot of machine money. that somebody's making some good bucks on. But, I mean, it's ridiculous. And we just don't feel as though anybody's getting anywhere. And they also close like supposedly it's supposed to be our activity room for the people in the building. And, according to them, it was, infested. Well, that didn't happen until they brought some, furniture, two couches over from the main building at Wakefield and put them in there. And took the ones we had in there out. And then all of a sudden we were infested. And it's like, the people in the building can't, go down like, it wasn't that it was used a lot, it was like football. For the football games, everybody would gather, bring food down and whatever. And, we always made sure it was clean afterwards, we'd get rid of the trash. The group of us, there's about 8 of us, would decorate the thing for the different seasons and all that. We kind of made it, like a living room, like where you go and hang out. But now we can't even do that because supposedly it's infested.
Thank you so much for sharing. We will be discussing it in detail a little bit later on the agenda schedule.
Yeah.
I will say that I'm well aware of, what's been going on. And
we've talked to Eric.
Yeah, and the inspectors have been very much, trying to work with them and educate and make some changes with things. So we certainly appreciate, your concerns and what you've been going through. And we, like I said, it is on the agenda to discuss a little bit more in detail and, update the rest of the board members, because they're not, aware of everything. So we will discuss it further.
Okay.
So, but we do appreciate, and, your concerns, our concerns are there too.
Yeah.
With how things, and I think we've got some things more clear as to what's been happening, so we will discuss it in a little bit. Okay,
Thank you.
thank you. Okay, next thing on the agenda is review the minutes from July 21st, 2025 and September 22nd, 2025. By the way, we do have a quorum. I know Jeff's not here today, but because we have 3 members out of 4, that does equate to a quorum, so we are able to continue.
And I wasn't at the September meeting, but I did look at the July ones.
Okay.
I can make a motion to approve those.
The July meetings.
July.
Motion is made and seconded to approve the July meeting minutes. And any discussion? They did look good for me. Everybody approve? I do too. The September minutes, I make a motion to approve. Emma seconds, and
I don't know if you have a quorum to vote
oh,
on those.
actually, no, we don't have a quorum to vote on those, you're right, because there's only the 2 of us and you weren't here.
All right. I'll just-
So we will table the September minutes for next meeting. Okay, next on the agenda is the health department updates.
Okay, so I'm going to start with staffing, and as you may be aware, Micah Blundow has resigned as the director of the department, and I will be serving as acting director until the position is filled. Brandy also resigned as the administrative assistant, and her last day was October 1st. We have filled her position with a woman, her name is Dewan Falzone, and she started on October 22nd. Stan Dalasewicz, who was our transfer station supervisor, retired last week after being out on a leave since June. The position is still vacant at this time. Eric will be assisting with supervising the attendant until that position is full. The position of administrative coordinator has been vacant since March of 2025. It was previously a 37-hour-a-week position. The position was posted last week as a 19-hour-a-week position for part-time. Next, I have the landfill transfer station and solid waste. The leachate pumps replacement and groundwater monitoring project is underway. The purchasing department has awarded the contract, and they were doing the signing by all parties today. Eric will continue to monitor the levels of leachate, and Wind River is manually pumping out the excess about every other week, and will continue to do so until the pumps are fixed.
Do they, are they confident they can get them this soon?
I'm hoping that the project will be done in November or December.
Okay.
And once the contracts have been executed, I believe they're hoping to move forward quickly.
I know those funds have been you're taken care of
Mhm.
as far as appropriation and if they're signing the contract.
Yeah.
And that does not include the erosion repair.
Correct. The repair of the erosion to the landfill cap, there's currently no funding set aside for that project, and we're gonna have to look for creative ways to get that funded, speak to the mayor, speak to the city auditor to see what we can do.
Which means that we're gonna replace the pumps and the groundwater monitoring, but the erosion has been going on. And do we have a state DEP order?
I believe
On
there is
that?
a DEP order. This is a new
First
project to
right there.
me, yeah.
And it's been back probably 7 years. And we've gone through several directors. It's kind of been getting lost. So, it does concern me that we're not fixing the erosion is still gonna just wash everything down out into the groundwater, and the leaching pumps, which eventually are gonna end up failing again, so,
So I have that on my list to speak to the mayor and to the auditor to see if we can start locating the funding for that. For food establishments, the annual food, tobacco, and other sanitation-related permits open for renewals on October 1st, and that will continue through November 30th. There was one food establishment complaint, which was moldy bread on a sandwich. The consumer did have nausea immediately after noticing the mold on her sandwich. She did not eat the remainder of it. The establishment was contacted. They discarded the remaining bread from that batch of bread. The consumer was advised to call back if she experienced any additional symptoms or sought medical treatment, and she has not called back to report any additional symptoms or treatment. The Walmart deli and prepared food renovations are complete, and I did the pre-reopening inspection last week. Walmart to-go area is still under renovation, expected to be completed in November. We have several new food establishments in process. Some are in plan review, some are under construction. We have Coffee and Cream on the corner of Connor Street at Parker Street, will be pre-opening inspection this week. A new commercial daycare is going to be located on Colburn Ave for approximately 40 kids, and that is still in plan review. We have a new Brazilian deli and bakery under construction in the old Taylor rental building. Four Seasons is adding a bar, so they're under construction in their dining room. And the Dunkin' Donuts on Tiffany Boulevard is doing renovations on signs and awnings. And Gabby's on Pearson Boulevard is undergoing extensive renovations. They pretty much stripped that one down to the studs, and they're rebuilding it from the ground up. For housing, we are starting to get those no heat calls. As it's getting colder at night, people are trying to turn their heat on. We're getting many calls about that. I do have an update regarding the bed bug situation at the apartment complex. 8 units were identified by the new pest control company last week. We did advise the property manager to seek some additional estimates and treatment plans from other pest control management companies, because the previous pest control management company was unable to get the situation under control. We found they did the same thing in a different apartment complex for cockroaches, so we advised them that they should probably look at other avenues for treatment. The pest control company will be conducting inspections again tomorrow of the units surrounding the 8 where they found bed bugs, and they will begin treatment on all affected areas both on Wednesday and Thursday. And one unit is severe enough that we are actually going to condemn it tomorrow. The occupant will be housed by the owner for a 3-night minimum while we get that, hopefully get her unit under control.
So it's my understanding, I know when we met last week with Micah and you to review it all, so I understand that the previous past, because this has been going on for at least a year that we're aware
Yeah,
of.
we get calls on it off and on throughout the last year.
And the previous pest company was not up to par with what they were doing with treatments. And so then they've had a couple of new people come in, and did they choose one?
They did choose one, they
Okay.
signed a contract on Thursday. They're initiating more inspections tomorrow to make sure they get the outliers of,
So is that
Units.
what they're doing with Wednesday? I'm not sure why they're breaking up the treatments either.
I think it's the quantity of work that needs to be done, and they're trying to be very thorough.
So when you say in the outliers, have they treated, I mean, because the whole thing is they're gonna go from one department to the
Yeah.
other.
So typically what we do when we have an impacted unit is if there's only one, and I know it's more than one, but you want to treat next door,
Right,
on either side, up and down,
right.
okay? If there's a unit across the hall, we tend to want to treat that one also.
Mhm.
So they're going to try to figure out how large of an area needs to be treated. They also do plan to treat the community room and the laundry room.
How many units are in the apartments?
I believe that one, that building has 70-ish units.
Yeah, I'd say.
Okay, thank you.
I mean, where it's in the laundry room, and I'm not sure why they opened it up, and, because I thought they were well aware that it was in the laundry room. I don't understand why they opened it up without treating it. And then even, who was the one that brought the couches in from, and where they brought the couches in? Did they, you can't, you have to be careful with bringing in used furniture.
So I feel as though we were not consulted on what the plan should have been. They were taking guidance from the original pest control company, and the guidance might not have been strong enough.
Right, it was definitely not.
We have provided them with the integrated pest management plan for large apartment buildings, which is I think a 25-page document telling you how to manage these situations. And that integrated pest management system also has periodic surveillance and treatment, even when there isn't a problem, which is what most restaurants do. And so that's what we're going to start looking at going forward. I was not personally the inspector on this case, so I'm coming into it a little bit later, but I've been working with Eric to make sure that I have all of the information. I spoke with Jennifer at length today, trying to make sure that we have the right plan in place, not just a plan.
Is that the property manager?
Jennifer is the property manager.
Now, is there educational materials that can be provided as well that?
We did send out some educational materials from the Department of Public Health. They were emailed to Jennifer. I will follow up with her to see if those were dispersed to the residents. As of right now, you haven't received them?
Because that was the other thing, is that, within all the apartments, wherever the ground zero was, whatever was identified as where the apartment was, and I understand, was it you that there was a miscommunication and they notified you that it was your apartment at one point, but it was actually another apartment, I think,
I have been getting bitten. I called the apartment manager and informed her that it could have been either fleas or bedbugs.
right,
Because they both bite.
right, they do.
They came that afternoon to check. And the company that came didn't come until almost the weekend to do a treatment. Like Thursday or Friday to do a treatment. Then they didn't say how soon they would be coming back to check. I unpacked everything and then had to repack everything again.
Okay. So that was gonna be my next question, is how often, they're asking you to pack things up in plastic bags, garbage bags, I'm assuming because they wanna keep whatever they can't spray or clean, you
I
want to be contained in the bags and kill the bugs. Are they giving you a length of time to keep them in the bags before you undo them?
No,
No.
Okay.
no, they did not.
That
If
should be
if
addressed.
they had told me, I would have waited.
Mhm.
Now, it's very costly for the bags.
Right, no, I know. And the good news is that bed bugs, they don't carry, they're not a vector that carries diseases, but they are a nuisance, and their bites can be very much, a concern, obviously. It's just the whole getting rid of them in an apartment complex like that, like this is challenging, but it can be done. It just has to be, And then, like you mentioned about the furniture and the mattress, and that's, even if they brought in some couches, I don't know where they brought them from. I mean, you have to be very aware.
Well, this one person refused many times to have anybody go into her apartment to check.
Right.
And, I mean, that right there is like, it's like against your lease. You're supposed to allow the people in to check. And she's still living there, and
We also have looked at what other resources, for some people that, they need assistance to manage this, whether it's, calling, a family member, or if there's other community resources. We have been looking into that. It's challenging when, somebody
well, I mean,
refuses.
she's thrown out or gotten rid of everything but her couch in her living room, and had to get new furniture.
And a mattress besides.
Yeah, plus a brand new mattress.
Well, the mattress was old, but I got a brand new mattress in
Yeah.
addition to.
But I am related to Mrs. Gonzalez, living out of Barking up in her. She's spent at least $1,100, and even though I don't reside there, touch with her any helper because I work 7 days a week, and my daughter can't make it up here. She's in Rhode Island. She feels guilty. But I see this woman here, the stress, the despair, the anguish is killing my daughter. And my daughter is afraid to go into their apartment, and I help her as much as I can.
Right.
I've been lucky and haven't caught any of these things. I mean, but the stress is horrible.
Yeah, and the other concern is that people going from one apartment to the other, or anywhere, there is possibility of, bringing them.
And these people in the age bracket,
Yeah.
that's too much.
Yeah, no, yeah.
So I just did want to make sure that, I can sympathize with your challenge. This is an extremely difficult situation. It's very stressful. It can be, as you mentioned, expensive.
Very, very stressful.
Very, very stressful, very expensive. My former mother-in-law lives in the building, and I helped her with hers last year. But what I want to stress to you is that the board's position is to enforce the sanitary code and to try to do everything we can to eliminate the problem. We are not limiting your other resources to seek damages from anyone,
Oh, yeah.
but that's something that we cannot do for you.
Well, no,
So I would encourage you to look and see what your options are for those damages.
I'm not asking for the damages, okay? But there has to be a system that, yes, I notified them, but why aren't they may be doing it now, but why haven't they been from day one, at least once, every 6 months, going through all the apartments to check to see if there's bed bugs?
That's something that we, as Angela said, the board health department's role is to enforce the sanitary code, and that's something that there's been, in our investigations with the inspector, revealing a lot of this information that where things have not been clearly followed in a logical manner, or up to following the guidelines, and that's something that the inspector and the health board will continue to work with the property manager to ensure that that's done. We're not going to just step away,
No,
and we will ensure that they are doing that.
Unfortunately, at this given time, it is affecting me. But we have older people than myself that live there. That's why I think that they should be checking more
Yeah.
frequently.
So we can definitely impact what they're doing going forward. We can't change what they did before, but we can definitely make suggestions and place orders so that they have a clear plan that they're gonna follow and that we're gonna follow up with them about.
Yeah.
Okay, so we're
Yeah,
gonna work.
That's great.
my understanding is now, hopefully, there should be like a set, like every 6 months or something like that, that the whole building should be sprayed or checked or,
They have a new, they did sign in with a new pest control company as well,
yeah.
Yes.
which hopefully they will be more on top of it in a different, because I don't think what the previous
Yeah,
people were doing was effective.
nothing.
And it didn't sound like there was follow-up because, I mean, this was the first I had heard about it being a problem, so severe and stuff. And I think that between the inspector that's been out there and the health department, they've been on top of it. And I identified a lot of the areas where they can improve.
Mhm.
And the educational materials, they should be getting those out. And, because people going into the building, there's all kinds of people that go into the building, go into the homes,
Mhm.
medical people,
Home health
visitors.
Yeah,
CNAs.
Yeah,
The deliveries.
and I don't know that they're aware as well, people going into the different apartments, we
Well,
need to.
I have a cleaning person that comes in. I have called their department where they located, and I have said, I've got bed bugs, I'm being sprayed, please do not send my
work.
person to come into my apartment. I have made it a point of telling them not to come. But I'm proactive, a lot of people are not.
Right,
Maybe they're afraid to say, there's something going on in my apartment, and I'm afraid to tell anybody about it. And I think that's part of the problem there too.
we're gonna talk to the property manager. I don't know, I'm really not sure if we're, can post something on the building entrances about it or not, but that's something we'll have to look at the
The only
guidelines.
thing they put like down in the bowling room, they put a sign on the door that says out of order,
Okay,
and they lock the door.
okay.
I mean, is there like a meeting room, a common area where?
Yeah, that was it.
Community room.
That was our common room.
Yeah,
Is maybe the property manager and maybe with Eric or something?
Yeah, so I'm gonna be on site tomorrow. I'm gonna be there meeting with Jennifer and with the pest control plan, as I the pest control management company, and we will be condemning one of the units tomorrow.
Thank you.
So that will be a big step forward,
mhm.
and that unit will remain condemned until I feel that there is no pest activity in the unit.
What we've been doing, I myself included, we've been spraying our own apartments.
Yeah,
And we're not supposed to because
Yeah.
it makes everything go outward.
Right,
well,
it's probably not the best thing, let the professionals, continue. Like I said, they have a new pest control.
Yes, I've
and-
talked to them.
And there's been, with the investigation, I think more communication we've uncovered a few areas where they need to improve, and Angela and Eric have been talking with the property manager, so I would let them try to go with their plan and see what
Okay.
happens.
one of the things that I would just caution you about using your own pesticides is that when you put your pesticides in the problem onto the property, not only do they spread out, but your pesticides may interact with his pesticides, may interact with the new pest control company's pesticides. You wanna be careful about
I do
mixing too
understand
many
that
different
too.
chemicals together, because you don't wanna poison yourself,
Yeah,
No,
okay?
definitely not.
so, and I think if we can get some educational materials, maybe somehow meet with the property manager, and she should be able to explain some simple things.
Yep.
Yeah,
I'm gonna
Yeah.
print out some materials that I can bring to her tomorrow in case she did not receive the files that I believe that Michael sent her last week. I don't have a way of checking
Yeah.
that at this point, but I already put on my to-do list to send those, and I will bring hard copies with me so that Jennifer has them to copy I will make them available for you, okay?
Well,
Okay.
that would be awesome,
Yeah.
because we are all concerned, even though no one wants to admit they have them, we
Right.
are all
And
concerned.
yeah, and unfortunately, when you live in a community living like that, in an apartment building, all it takes is one
Yeah.
to bring it in. If it, after, this process is done with the new spraying, if there's still problems, please, call the health department and let them know. Keep us updated.
Oh, we
But,
I have a number already for
all
you.
right, but, hopefully,
And we have, some of us have Eric's card too, so.
okay, all right. Because I know, like I said, it was a lot that was discovered that was, not aware of. The reports were coming, I think, to the property manager and to everybody that everything was good, they weren't finding
Yeah.
any.
Well, our main thing was a lot, not this week or last time, but like the time before when whoever it was that came in and did her apartment said she was fine, she didn't have anything, and then like the next week, they're like, oh, we've gotta do your apartment again, bag everything out. And it was like, you just said that we had nothing. I mean, I can see like as a cautionary thing going back, but let them know that, they're gonna come back, so don't unbag everything and,
Yeah.
Do you know how long the bags, because I know with head lice, we used to do this with the schools.
So,
It was a
anything,
couple
yeah,
weeks.
anything that you're bagging that cannot be chemically treated should be washed or cleaned
Yeah.
independently as you're taking it out of the bags. Unfortunately, bed bugs can live up to 6 months without feeding,
Okay,
so we wanna make sure that we're cleaning them off, you're
Yeah,
treating things with cleaning products, you're laundering them, you're heat drying them.
Another thing is they expect us to go out and like to Harkins, for example. Those of us that don't drive, those of us that have no other transportation, I've got a lot of clothes. How am I gonna get them there? They don't want us, I myself.
I don't want you bringing them to Oregon, so I will talk to Jennifer.
No, I'm just,
We do not want, I do not want you bringing your items off the property, because now you could be bringing them to another establishment, which could spread them further.
we
So-
only have 4 washers and 4 dryers.
I understand. Let me look at the integrated pest management plan and see if I have any recommendations from that plan to see if I can come up with some solutions for you. What I also want to instruct you to do is from now on, when you report any problems to Jennifer or the office, also call our office, and I'm gonna start keeping a spreadsheet of which units are impacted and when they get treated, which is what I've done in another development for cockroaches before. And we were successfully able to pinpoint where the real problems were and get the treatment done, and we've actually cut down the number of cockroach reports from that property. Right, that's, right, Paul.
if, maybe she can also.
You guys are listening, right? So you can repeat it back to me again, please.
So, I mean,
That's
But-
unusual.
Yeah, obviously, 70 people, 70 apartments can't go down trying to use a laundromat with 4
Yeah.
washers, so maybe she's gonna have to try to,
Maybe we schedule times, maybe you do one bag at a time, not everything at one time. I know that sounds challenging, but we've gotta do it thoughtfully with a plan so that we protect everybody else.
What if they meaning the office, I know they have them out there. They do laundry service. Because my daughter looked into this for me. It was gonna cost me $2,500 to have them pack me up, pack my stuff up, take it out, and do the bug treatment that they do for, for the laundry, and then bring it back. It was gonna cost $2,500.
Per unit,
yeah.
probably. Yeah, all right, let
I'm
me
just
look,
saying that,
Yeah.
I don't know who she talked to, but she looked into it for me.
if you can get the name and number of that company, and I'd appreciate having that, and you can call Eric with that information, that'd be great.
I'll get it
And
from
I'll
her.
review the integrated pest management plan so that I can see if I can figure out what the best next step is.
That's packing us all up, even.
I know it's
I've
challenging.
got mine almost all done, but yes, it takes a long time to get them all back in and then be told that you have to back up again.
right.
Yeah,
right.
so let's maybe, as you're bagging things, do it thoughtfully, where you put the things you need first, all in one bag,
Yeah.
and the things you use the least, like your summer clothes right now, in the bag that you don't open for a
I
long
wear them all
time.
year long, by the way.
Huh?
I'm one that wears summer
You wear all of your
all
summer-
year long.
Well, maybe, like I said, try to thoughtfully think of it so you can open as few bags at a time as possible. The things you need most urgently first, and the things you need less urgently last,
All right.
so that you have more
Question for
time.
you. Like
Sure.
I have, summer, winter clothes, all that. I put mine, I have a cedar chest,
Mhm.
and they're in the cedar chest. Now, would I have to take those all out of the cedar chest?
That's a good question.
Probably, I think cedar's for moths. but
Yeah, I believe it is.
It stops bed bugs, but,
But I wonder how airtight it is.
yeah, I don't know.
So,
Well,
yeah, I'll look
put
it
it
up.
this way. It's in my closet,
Mhm.
and it's a good size cedar chest. And it's not airtight, but with everything that's on top of it, it's airtight.
All right, well, let me look into that a little bit more for you, okay?
Okay.
Thank you.
All right.
It's on the bagging.
Yeah, I know with
Yeah.
headlights, we used to do this, a similar thing, and,
Mhm.
Or washing at 140 degrees or freezing
Yeah.
at -4
Right.
Fahrenheit for at least 2
the
hours.
outside sitting,
Yeah.
and I used to tell people to put it outside too, but,
We don't have -4.
So-
no, we don't.
One of the things that I can look into is reaching out to our emergency management coordinator for the city and see if he can locate a mobile service. We
Yeah.
talked about this when the migrant shelter opened, but it was not approved by FEMA. But we can see if maybe we can get some contact information, see
Yeah.
what that cost would look like to bring a mobile laundry onto the property. So that's something I wrote down as a potential avenue to explore more. So I do have some ideas, I just have to start implementing them, and this just got handed to me last week, so.
Yeah, and we-
I have not been
Wrong
involved.
you.
I mean, last week is when they really just started unraveling a lot of the
Yeah.
pieces that weren't aware of. So I think with the education and the new system, the new pest control and everything,
And our vigilance.
yeah, so, yeah, just make sure you let the health department know if you're calling and, more
Yeah.
issues.
Yep. And so what happens moving forward is I'm gonna request the pest control reports, and I'm gonna request that by unit, and I'm gonna start a spreadsheet, and I have the building diagram, so I'm gonna try to figure out
Okay.
how we're doing, and if we can, have a repeat in usually 2 to 3 weeks, they usually come back to repeat a treatment, depending on which insecticides they use. So we'll try to clarify what your expectations should be for retreatment, and then I will ask them when they're coming back to re-inspect, because I feel that this is probably gonna be a 3 treatment process for this particular situation. So don't unbag anything until we direct you to do so, unless you absolutely need to.
Well, I was just gonna say, did you say 2 or 3 weeks after?
Typically, you do 1 treatment, it takes up to 1 week for the full effect, and then they come back a week later, they'll re-inspect and they'll retreat as appropriate, and then we wanna do that again, probably a 3rd time.
Well, then I'll go back and get what clothes that I might need, because by the time they come back and I'm through, it'll be Thanksgiving. No, really?
I know, but we wanna make sure we do a thorough job this time, so I'm gonna stay on top of this one for you guys, okay?
Thank you very much.
Thank you.
What were the exact deficiencies with this old pest?
They were using a more broad spectrum pesticide that you commonly apply in a restaurant for preventative for multiple types of bugs, not a specific one for bed bugs.
And they were reporting that everything was good, but they
Do
really,
they have
we don't
any
know.
liability to help with the expense of rectifying it?
That would be something that
They would
they would
have
have to
to,
explore.
yeah.
Yeah.
But it's a good
So your
thing to
daughter
explore.
must be Andrea, who's,
Yeah,
yeah,
it's our
okay,
daughter, yeah.
she, that's, yeah,
Yeah, she's our daughter.
she notified.
She did get in contact with you.
Yeah, she did.
I have a question though, before we do disband. The dirty clothes I have right now is not, it's just a little bit at the moment.
Mhm.
But if they're coming to spray my apartment on Wednesday, if I grab as many clothes as I can and put it into a bag saying it's gonna be my dirty pile,
Yeah,
I can treat them, I can wash them. And can I hang, once they're done with the treatment, can I hang the clean clothes up into the closet?
no, I would repack them into plastic bags so that they don't become re-infested. You're gonna be, unfortunately,
Well, that's a question that nobody else would think
I
of
will tell
asking
you, I will tell you that you want to take all precautions that you can to prevent them from spreading into your cleaned items also.
Yeah, so that's where, I think, meeting with
Jennifer.
Jennifer and making sure that somehow this information can get dispersed to all the tenants.
I'm gonna talk to Jennifer tomorrow about maybe doing a community meeting.
Yeah.
And you know, it's just, I know it's a silly question, but
No, it's.
I gotta wear clothes.
Right.
I need water, I need face cloths.
Yeah, it's been going on too long.
So they need to be accessible always.
Yes. It may be more uncomfortable, more challenging at the get-go next week, this week. But I think we'll have a better outcome if we come up with a plan that everybody follows these steps and we try to get a lot of communication going on. And I'm gonna reach out to Jennifer again tomorrow to see if we can maybe do some community education, offer a meeting in the building.
That's one of the big problems, is
Mhm.
There's
no communication,
Yeah, I know.
up and down.
I heard you.
Which was the other.
I heard that. So I've got some ideas on how to try to solve that problem for you.
Unfortunately, it's like a
Right
drill
now, the
sergeant
attitude
doing
is-
that.
I've got another list.
Yeah.
All right.
All right,
I'm gonna move to the next item.
okay.
There have been 2 other new bed bug cases in different buildings, not related to this
That's the one I was
infestation.
talking
Those are the ones, yes, that Mike
Yes.
told you
about.
about.
Okay.
We have 1 case in housing court. It's a 3-family with multiple uncorrected violations, including some no heat in 2 of the apartments, insufficient hot water for the building, missing safety railings, exposed electrical wires. I took this to court about 4 weeks ago. The owner was ordered to repair all of the CDEs within 30 days, and I'll be doing a re-inspection on that this week. Up until this past Friday, he had not made any repairs. However, he was in communication with me Friday and Saturday. He said he was going to visit the building, he was going to have somebody come in and service the furnace, but I have not heard an update, so I'm gonna be chasing that one again today or tomorrow. And the remaining violations, which are not the CDEs, conditions deemed to endanger, are ordered to be repaired within 60 days. One of the units in the building became vacant after I went to court, so I condemned it to prevent somebody else from moving in there until the repairs are complete, so that he can't get somebody else to come into this problem and start their tenancy in an awkward position and be taken advantage of.
And the bed bugs being there, I mean, that's the other thing on your list when you meet with Jennifer tomorrow. I mean, when we discussed last week, there may be a crossover of,
From building to building.
yeah,
Yep,
from a certain group.
I'm familiar with the gentleman, I think, that may be visiting
Okay,
friends or family
Okay.
at another building.
all right, because we're.
That's why I want to do a community,
That's how-
I want to do a community meeting, and I want to see if I can get that arranged for maybe
Okay.
later this week or early next week, so that we can kind of stress the importance of limiting, just like we did in COVID, social distancing, limiting your interactions with other people, and limiting your time in other people's units for a week or 2.
Well, just to get,
Right, it's a small sacrifice to make to get to the greater good. Moving forward, the prevention coordinator, there was a domestic violence vigil event at City Hall on October 6th. China 9 annual meeting was on October 9th. Hispanic Heritage Month was at City Hall on October 15th. District Attorney Early's conference was on October 23rd. We have gotten Mass Cultural Council reimbursements for the Mass Cultural Council, and a new grant cycle is closed. The meeting will be scheduled for next week. This is all from Veronica, so I don't have a lot of details about those items. Arbovirus, tick-borne illnesses, we're pretty much at the end of the season. We've had a couple of good frosts now. Gardner was always at low risk this year for a triple E and West Nile virus, but we do still recommend taking precautions when spending time outdoors up until probably mid-November.
yeah, ticks are definitely still out there. I know some of my neighbors have recently had tick bites,
Yeah.
Especially if you're walking in the woods or.
Yeah.
Warm day in there.
Yep, and I pulled them off the dogs on those warm days. For vaccine clinics, the PACC had a clinic on September 24th. The Banal House had one on October 6th. City Hall had their public and employee clinic on the 20th. They only had the COVID vaccine at the October 20th at City Hall because the vaccine came later than the flu vaccine. So Victoria will be working to schedule follow-up clinics for COVID vaccines, and I will let you know when that happens.
And all the pharmacies are able to do the flu and the
And the COVID.
COVID.
Yeah, I'll be going to the pharmacy this year because I had a training on the day off campus that we had our employee clinic. For new business, unless anybody has any other old business.
I have, let's see. Okay, so new business.
New business, medication disposal. The Gardner PD temporarily stopped accepting medication for disposal as there was a moratorium. It seems like that came as an issue from the state police and the wheel grader.
They were bringing their drugs, the medications to be disposed of in the state police incinerator, and they stopped doing it because there's so many. So they have not been collecting them,
Mhm.
although they did have the Take Back Drug Day at Price Chopper on Saturday. And we do have a
Yep.
option
my next
that's,
step.
yeah, an option of less
Less
expensive.
expensive, yeah.
That is something that we will pursue with, I told the chief that one of us would share it with them.
Yep. And also with the sharps disposal, as the costs continue to increase significantly every month, the PD budget was not funded to support the increase. Sue reached out to the MPHN and forwarded the resources that the MPHN is using to the Gardner Police Department, and we'll be following up on that to see if we can change our provider for disposing of our sharps, because it's really important that we continue to do that.
Seemed like every time I went down there,
So
there was, it was full, and
Mhm.
and then there was no medication place, so.
Yeah.
Anyway.
And the last item I have on new business is the Public Health Emergency Preparedness Tabletop event, which is going to go over our emergency management plan. That's going to be a virtual meeting on November 20th from 9:30 to 10:30. When we say virtual, that means the PHEP will be meeting us virtually, but we have a room at the community room at Gardner PD, so that our group can collaborate together in the same room on the plan and update the plan, go over all of the steps, make sure the right names are plugged into the right places, the right phone numbers and contact information, the right kind of phone tree and triaging that needs to be in that plan, can be updated and reviewed in person with all of our group. So I plan to attend that event. I believe Sue does.
I'll be there.
Paul Topolsky will be there. I think,
I was trying to think of who else we should include, and basically,
Fire Chief
Like-
LeBoy.
he'll be, we included fire, police. I was actually gonna also send it to, the safety council, public safety, and actually all of the counselors, the mayor. And I, wondered about, when I was looking at, we have a, draft of a hazards plan, I think it's called multiple hazards plan.
Mhm.
Emergency preparedness, and one of the scenarios to address was cyber attack on a hospital. And we never got it drafted in, to Gardner's community, but that's something that needs to be done. So it made me think maybe we should include somebody from the hospital, especially in lieu of the fact that they just had a cyber attack.
Right, maybe the chief medical officer, I'm thinking, or they also have the IT department, but they're pretty.
And I'll send it to
right now.
Dawn, and she can disperse
Yeah,
it.
see who she thinks should,
I'll send it there, and can send copies of everything. And if anyone else that we're forwarding it to can certainly share, the more the merrier. It has to be done yearly, and if we, the Public Health Emergency Plan Region 2, which is what we're part of, if they've got it all, templates and draft, the scenario we're gonna do, we can do it on November 20th, and it's the after reports, they'll still give us the templates, and we have to, complete it according to what our needs are and how we did our discussion, the tabletop exercise. If we don't do that, then we have to we can do it all on our own, but it's like, why, when we can do it. So, yeah, so that's November 20th. And it's in the community room we have.
I believe so.
Yeah, so that's good. Okay, anything else I have on here? The MOA, the Mass Health Association, Officer Association conference is next week. I know I'm gonna be attending.
I will be
Angela's
attending.
and we're still trying to get Eric to go.
So Eric is going to go on Tuesday to complete his housing tier 3 class, or actually to initiate his housing tier 3 classwork. Unfortunately, we discovered when we were trying, he was gonna go Tuesday, stay overnight Tuesday, go to Wednesday morning and come back for Wednesday afternoon to help Brian at the transfer station. When he called to cancel his hotel reservation, he discovered he didn't have one.
Oh,
So he is now only going to go for Tuesday during the day, he'll come back Tuesday night.
okay,
But I will be there for all 3 days
all right.
with my cell phone and my iPad.
Okay, well, all right, so next item on the agenda is setting the next meeting. That's in November. So the 17th or the 24th?
The 24th being the week of Thanksgiving.
Mm-hmm.
Right there yet.
I'm available either Monday.
Let's see. That's the 17th, which is a possibility. Oh, I just went back to today. I can do either one, I'll just move my schedule around, so whatever you guys wanna do is fine.
You want to do the 24th then?
That's probably closer to a month, right? It's
Yeah.
just- Yeah.
Because we're on the 27th today.
Yeah, it's the 24th.
Okay. We are going to move into executive session, so we plan on discussion on the health department staffing. So we will adjourn from the executive session, but we can take a pause here while we go, if I can have a motion to do that. So moved.
Yeah.
Okay, second.
Yeah.
All in favor?
Aye.
Aye.